Welcome to Module 11 Overview. This module covers topics related to the Healthcare and Disability Management Knowledge Domain, which encompasses 5% of the questions on the CRC exam. The information in this module is organized into 2 lessons. 1. Health Promotion, Prevention, and Management, and 2. Financial Support, Insurance, and Workers' Compensation Programs. The CRC exam includes 2 major sections, Rehabilitation and Disability, and Counseling. The learning objectives are organized based on this structure. The learning objectives for Rehabilitation and Disability are identify and supply resources that facilitate appropriate medical interventions, recognize the diversity in healthcare benefits, delivery systems, and the influence of services on individuals with disabilities, summarize and collaborate with health promotion and wellness provided in terms of strategies for people with chronic illness and disability, describe different insurance programs, identify and implement disability prevention and management strategies, and recognize the variability of workers' compensation laws and practices. There are no counseling learning objectives for this topic. The learning objectives and topics covered here were generated based on information provided on the CRC website. Welcome to Module 11.1, Health Promotion, Prevention, and Management. Topics covered in this review are disability prevention and management and models of health promotion and wellness. Disability prevention and management. A client of a rehabilitation counselor may need various forms of medical or health-related care. As a result, the rehabilitation counselor will need to understand healthcare-related terminology and systems in order to guide client treatment and rehabilitation care. As an example, a rehabilitation counselor may need to help clients through physical, mental health, or occupational rehabilitation, which requires rehabilitation counselors to communicate with interdisciplinary teams of doctors, therapists, or other medical health professionals. Therefore, health prevention, promotion, wellness, and management techniques and strategies become an important knowledge base for a well-rounded rehabilitation counselor. A healthy lifestyle begins with good prevention strategies. The first strategy is diet. Diet includes consuming healthy meals and removing bad habits like smoking, drinking, or drug use. A rehabilitation counselor may be able to help a client learn about nutritious foods by engaging with the U.S. Department of Agriculture's USDA MyPlate website and app, which provides consumers with resources, tools, and recipes that promote good eating habits. Exercise. Engaging in regular exercise helps reduce an individual's chance of getting certain diseases, improves or helps maintain a healthy weight, improves mood, and helps manage stress. Stress management. Excessive stress can lead to disease and poor mental health. There are several ways to help manage stress, including engaging in exercise or relaxation strategies. Hygiene. Poor hygiene can lead to certain health issues, so it is important for an individual to engage in regular washing. Dental care is also important to help prevent certain diseases. Disability management. Rehabilitation counselors who engage in disability management, or DM, help workplaces create safe environments to prevent employees from suffering from illness and injury as a result of the work environment, as well as help employees engage in appropriate treatment if they do become disabled. DM programs were developed to help employers reduce the costs incurred from work-related injuries, maintain a skilled workforce, and enforce legal requirements. The goals of DM are to 1. Prevent illnesses and injuries from occurring, 2. Provide early intervention when illnesses or injuries occur, 3. Help individuals who become disabled find appropriate resources and treatments to manage the new disability. And 4. Help the individual with disability safely return to the worksite when possible. Many programs and strategies can be used as part of DM, including outplacement, work hardening programs, work transition programs, or employee assistance programs, or EAPs. A rehabilitation counselor may need to engage in case management, workplace evaluation or intervention, program development, work environment or task analysis, occupational rehabilitation counseling, ergonomic evaluation, job accommodation consultations, or treatment planning. Since rehabilitation counselors who engage in DM may need to work with both an employer and an employee who incurred a disability, the rehabilitation counselor may need to be well versed in organizational change, collaboration, and mediation skills. The rehabilitation counselor should also be aware of all relevant laws associated with workplace safety, insurance, and job-related accommodations. Models of health promotion and wellness. Developing healthy habits and strategies often requires an individual to change their current lifestyle. As a rehabilitation counselor, it will be important to promote healthy behaviors and strategies to clients. There are multiple evidence-based models and practices that can be used to help a rehabilitation counselor develop treatment plans that influence healthy client behaviors. The Health Action Process Approach, or HAPA, is a model created by Schwarzer in 1992. This model predicts that actions that promote health and wellness stem from two phases. In the motivation phase, an individual explicitly creates an intention to change poor health behaviors for good behaviors. An individual forms their intention based on their self-efficacy, outcome expectancies, and risk assessment. In the volition phase, the intention is turned into instructions for the individual to execute the behavior. Action planning, coping planning, maintenance self-efficacy, and recovery self-efficacy all influence how an individual turns an intention into an action. The health beliefs model describes that actions are based on two predictors. One, belief that an action will have a desired outcome, i.e., perceived benefits and barriers, and two, perception that the threat will cause bad health, i.e., perceived susceptibility and severity. Additionally, self-efficacy and cues to action also influence an individual's behaviors in this model. The social cognitive theory model describes that an individual's outcome expectations are predictive of a change in health action or behavior. The theory of planned behavior describes that an individual's intention will influence their health actions or behaviors. An individual's intention is influenced by their attitudes, subjective norms, which is the belief that people close to the individual believe that the action is helpful, and perception that they can enact the behavior. The theory of reasoned action describes that an individual's intention will influence their health actions or behaviors. An individual's intention is influenced by the value the individual places on the outcome, their attitude, and their subjective norms, the belief that people close to the individual believe the action is helpful. The trans-theoretical model, also called the stages of change, describes the stages an individual progresses through to induce changed behavior or action. These stages are 1. Pre-contemplation, 2. Contemplation, 3. Preparation, 4. Action, and 5. Maintenance. Module 11.2, Financial Support, Insurance, and Workers' Compensation Programs. Financial support and insurance programs. Individuals with disabilities often need regular medical care or equipment, which means health insurance can be particularly important for this group of people. However, individuals with disabilities often deal with various difficulties, including prejudices as a result of pre-existing conditions, difficulty meeting eligibility requirements, or limited coverage. The Patient Protection and Affordable Care Act, the ACA, and the Healthcare and Educational Reconciliation Act have put policies in place that require insurance to allow coverage to more types of individuals and provide a wider range of coverage. This has been beneficial to individuals with disabilities because of their healthcare needs. As an example, individuals can no longer be denied coverage based on pre-existing conditions or disabilities. Insurance is commonly considered an employment benefit where the employer covers part of the costs associated with the insurance plan. The benefits offered as part of a healthcare plan vary depending on the organization and type of plan. Insurance coverage is often categorized by primary, preventative, catastrophic, mental health, chronic, or long-term care, and insurance programs can be either private or government funded, e.g. Medicare or Medicaid, etc. Managed care plans. The goal of managed care programs are to help reduce the costs associated with health and medical related care. The following are some examples of managed care plans. Health Maintenance Organization, or HMO. Health Maintenance Organization, HMO plans will help reduce the costs associated with medical care as long as the care is within a specific network. HMO plans may have specific requirements and restrictions as defined by the plan. Preferred Provider Organization, or PPO. These plans allow for more flexibility when it comes to choosing medical care. However, it still may cost more to seek medical care outside of a network, but usually the costs are still reduced even when the medical care is out of network. Individual Practice Association, or IPA plan, is similar to an HMO where individuals can receive medical care from within a network, but for a specified fee. Point of Service plan allows individuals to receive medical care from a specific network for a reduced fee. It costs more to seek medical care outside of the network, but the costs are still reduced. Medicaid and Medicare. These are government-funded programs established in 1965 under the U.S. Department of Health and Human Services. Medicare is a U.S. health insurance program run by the Social Security Administration that exists for adults over the age of 65 and/or some individuals with disabilities. Individuals with disabilities may receive Medicare if they have an eligible disability or have been disabled for 24 months. There are 4 Medicare options. Medicare Part A helps cover the cost of hospitalization, inpatient, nursing home, hospice, and some other forms of care. Medicare Part B helps cover the cost of doctors, outpatient care, home health care, some medical equipment, and some other medical care. Medicare Part C, now known as the Medicare Advantage Plan, includes all the coverage in Parts A and B, but also some vision, hearing, dental, and prescription drugs. Medicare Part D helps cover the cost of prescription drugs. Medicaid is a program offered by the individual states that helps individuals who are financially unable to afford care pay for their benefits. Federal law requires that the states pay for some fundamental services, but because Medicaid is run by the states, it will look somewhat different in each state. In some states, individuals who qualify for SSI may be automatically enrolled in Medicaid. Veterans Services. The U.S. Department of Veterans Affairs, or the VA, is a program through the federal government that helps provide health services to military veterans at VA medical centers or other eligible clinics. These programs offer resources, additional education, medical treatment or insurance benefits, and rehabilitation or support services. Families or survivors of military veterans may also receive some services. Disability insurance. Individuals may purchase or receive several forms of insurance that protect the individual if they were to incur an injury or disability that forced them to be unable to work or to incur medical expenses. There are several forms of insurance that could be received by an individual depending on their life circumstances. Group short-term disability insurance. This insurance is provided in the short term, less than 26 weeks, for individuals who are disabled. This insurance is often through an individual's employer and supplements part of the typical income of the employee. Group long-term disability insurance. This insurance is provided when an employee is disabled for more long-term periods of time and often begins after short-term disability insurance ends. Long-term disability insurance provides benefits until the employee is able to continue working or a specified time limit is complete. Individual short-term insurance. This insurance provides benefits to individuals with disabilities but is not provided through an employer. This often means that benefits are flexible depending on the individual, and benefits usually last for less than a year. Individual long-term insurance. This insurance provides benefits to individuals with disabilities but is not provided through an employer. This often means that benefits are flexible depending on the individual, and benefits usually last for longer than a year. No-fault personal injury. This insurance provides benefits related to healthcare costs or loss of income as a result of the onset of disability. The no-fault clause means that it does not matter how the disability was incurred. Workers' compensation laws and practices. Workers' compensation programs are state-required programs that help employees who become injured in a work-related environment. Workers' compensation programs help replace lost wages as a result of work-related injury, facilitate necessary medical care, and/or provide necessary occupational rehabilitation services. As a result of the services they provide, workers' compensation programs help states reduce costs associated with work-related injury. As an employee who submits a workers' compensation claim must be evaluated by a doctor, who will provide a rating based on the American Medical Association's Guides to Evaluation of Permanent Impairment. This rating is used to classify an injury as scheduled or unscheduled, and these classifications are used to determine the extent of the benefits received by the injured employee. Scheduled injuries are injuries to specific body parts that are permanent in nature. This may include injuries to arms, hands, legs, or eyes. A formula is used to determine how much benefit is received for a specified amount of time. Unscheduled injuries are more generalized injuries that do not fall under scheduled injuries. As an example, an employee may have a wrist, shoulder, or hip injury that makes it difficult to continue engaging in their work activities. To determine the benefits received by the injured employee, the state uses a formula based on the difference in wages received by the employee before and after the injury. The ultimate goal of workers' compensation programs are to help the injured employee return to their pre-injury life, such as returning to the same position with the same employer. The following list describes the hierarchy for returning to work, where Level 1 is the most preferred path for workers' compensation and vocational rehabilitation services. Level 1, the same employer and the same position. Level 2, same employer but some alterations to the current position. Level 3, the same employer but a different position. Level 4, different employer but same type of position. Level 5, a different employer but same type of position with some alterations. Level 6, different employer and different position. Level 7, same or different employer and different position, but new vocational training is needed. Level 8, independent contracting or working for self. State workers' compensation. Individuals who are employed may be required by the state to invest in the state workers' compensation program. These programs provide individuals who become disabled financial support, insurance, and rehabilitation or support services. Because these are often state-level programs, the coverage provided is dependent on each individual state. Federal Employment Compensation Act, FECA. Non-military individuals who work for the federal government and become disabled may be eligible for financial support, insurance, and rehabilitation services provided by the Federal Employment Compensation Act of 1916.